Shifting now from the development of human rights to the implementation of those rights to advance health. Section 2 surveys mechanisms for implementing human rights in national efforts and facilitating accountability for health and human rights. We begin in Chapter 5 by discussing the importance of translating international law into domestic policy, and welcome Gillian MacNaughton to introduce you to this implementation process. Gillian.
Thank you, Ben. Foundations of Global Health and Human Rights is really an excellent new volume, and I'm using it this semester in my interdisciplinary graduate course on global health and human rights at the University of Massachusetts, Boston. The chapter Translating International Law into Domestic Law, Policy and Practice, which I co-authored with Angela Duger, provides an overview of the mechanisms through which international human rights law is internalized or translated into domestic law, policy, and practice. International human rights law is largely state-centered, meaning that it relies on national and subnational governments to implement it, to promote and protect human rights, and to provide remedies to victims of human rights violations. For this reason, it's important for public health scholars and practitioners, as well as others interested in promoting health rights, to consider how international human rights law is translated into domestic law, policy, and practice. For several decades after the UN was established in 1945, the organization and its members states focused their human rights efforts on developing human rights declarations, treaties, and institutions. In recent decades, however, there's been a shift from defining and conceptualizing human rights in international law toward implementing human rights on the ground and making them real in people's lives. International declarations, treaties, and mechanisms are essential foundations of the modern human rights system. But we also need to operationalize these rights in countries and communities in order to improve health and well-being. Our chapter is divided into 3 parts. Part 1 considers international legal obligations of governments to implement human rights at the domestic level. It then explains 4 approaches to do so, through human rights education, policymaking, judicial and quasi-judicial enforcement, and international processes. Part 2 examines how national governments and subnational governments use these approaches to translate international human rights law into the domestic sphere. And Part 3 looks at the crucial role of NGOs and how they engage these approaches to translate international human rights law into practical efforts at the local, national, and international levels. And the chapter concludes that public health actors must understand these complex processes of domestic implementation of international law in order to entrench health rights and build a domestic culture favorable to health and human rights. Thank you.
Thank you, Gillian, for introducing us to the importance of understanding the need to bring human rights home.